Let's be honest, if you have tinnitus, you've probably heard this advice. Just get hearing aids. And maybe you thought, seriously, that's it? Well, I don't blame you. It sounds too simple. If the ringing's in my head, how is turning up the outside noise supposed to help? But here's the thing, for most people, that ringing isn't random. It's your brain reacting to sound that it's not getting from your ears. And that changes everything. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah, and for over 20 years, I've been helping people navigate both hearing loss and that maddening buzz that never seems to quit. And today, I want to give you the real story. No hype, no fluff, just straight answers about how hearing aids actually help with tinnitus, when they work, why they work, and who they work for, and who they don't work for. First, let's talk about why hearing loss and tinnitus are connected in the first place, because understanding this is key to understanding how hearing aids can help you. Here's what happens. When you have hearing loss, your ears aren't sending as much information to your brain as they used to. And your brain will notice this. And instead of just accepting that reduced input, your brain will try to compensate by turning up its own internal volume. It increases activity in the auditory system because it's essentially trying to fill in the gaps where sound is missing. A 2023 study from Harvard Medical School and the Massachusetts Eye and Ear Institute measured auditory nerve responses in nearly 300 people. What they found was fascinating. People with chronic tinnitus showed loss of auditory nerve fibers even when their hearing tests looked normal, and they also showed increased activity in their brainstems. The brain was literally becoming hyperactive in response to reduced sound input. This explains why tinnitus and hearing loss are found together in more than 90% of tinnitus cases. Your tinnitus isn't random. It's your brain's response to not getting the auditory information it needs. Now here's the good news. If your brain is overactive because it's not getting enough sound, what happens when you start giving it more sound again through hearing aids? That hyperactivity starts to calm down. If you're finding this helpful, please hit that like button and subscribe. I put out videos like this twice a week to help you understand your hearing health and make better decisions. So let's get into the specifics of how hearing aids reduce tinnitus. There are three main ways that they help. First, they restore auditory input. By amplifying the sounds that you're missing, hearing aids give your brain the external sound information it's been craving. When your brain starts receiving adequate sound again, it doesn't need to work as hard or stay in that hyperactive, compensating state. This often leads to a direct reduction in how much you notice your tinnitus. Second, they provide something called sound enrichment. Even when you're in a quiet environment, hearing aids are picking up the ambient sound around you that you normally wouldn't hear, like the hum of your refrigerator or distant traffic, the rustling of your clothes. And these sounds give your brain something else to focus on besides that tinnitus. It's not masking in the traditional sense where you're just trying to cover up the tinnitus completely. Instead, it's giving your brain something more interesting to process. And third, many modern hearing aids will have built-in tinnitus sound therapy features. These can play gentle sounds like ocean waves, white noise, or customized therapeutic sounds directly through the hearing aids. This gives you another tool for managing particularly bothersome moments with your tinnitus. The key here is to understand that hearing aids aren't just making everything louder. They're giving your brain what it is missing, which often reduces the need for your brain to generate that phantom tinnitus sound in the first place. Let's look at what the research actually says. A 2023 study published in Frontiers in Audiology and Otology followed 40 patients using hearing aids with sound support over 12 weeks. The results were very impressive. The median tinnitus distress score dropped from 49 to 26. That's a reduction of nearly 50%. And here's what's really interesting. This worked for people who were both brand new to hearing aids and people who were already hearing aids but switched to devices with better tinnitus management features. Another study published in the Journal of Speech, Language, and Hearing Research looked specifically at people with mild hearing loss and chronic tinnitus. After 6 months of hearing aid use, they found statistically significant reductions in tinnitus distress and improvements in quality of life. Benefits here continued to improve over time as the brain adapted to receiving adequate sound input again. What these studies and many others tell us is that when hearing aids are properly fit and have appropriate tinnitus management features, they can provide meaningful relief, and that relief often builds over time rather than disappearing. And this isn't just individual studies now. The American Academy of Otolaryngology Head and Neck Surgery reviewed all of the available evidence and published clinical practice guidelines, and they specifically stated that clinicians should recommend hearing aid evaluations for patients with persistent, bothersome tinnitus and documented hearing loss. When the major medical organization for ear, nose, and throat physicians makes that kind of recommendation, it tells you the evidence is solid. Let me tell you about James. He came to see me about 3 years ago with tinnitus that had been bothering him for over a year. He described it as a constant high-pitched ringing that was worse at night and made it hard for him to concentrate at work. And he was just exhausted from constantly straining to hear in meetings, and the combination of hearing difficulty and the tinnitus was really affecting his quality of life. When we tested his hearing, sure enough, he had mild to moderate hearing loss in the higher frequencies. We got him fit with hearing aids and verified it with real ear measurements, and I explained to him that it would take some time for his brain to adjust. After 3 months, he told me something interesting. He realized he'd gone several hours without even thinking about his tinnitus, which is something that had not happened for him in well over a year. His brain was getting the sound input it needed, and it was calming that hyperactive response down. Now, a year later, he's telling me he has lots of days he doesn't hear it at all. But it still is there. It didn't disappear completely. He notices it sometimes, especially when he takes his hearing aids out. But his distress level because of his tinnitus went from 9 out of 10 down to a 2 out of 10. And that made all the difference in his quality of life. It's important to understand that hearing aids help tinnitus most effectively when the tinnitus is caused by hearing loss. If your tinnitus is from something else like TMJ disorder or a medication side effect, hearing aids will not be the right solution for you. This is why proper evaluation is critical. You need a comprehensive evaluation to see if hearing loss is present and what your specific hearing looks like. But you also need a tinnitus assessment to understand what's driving your distress. And here's something people don't realize. Not all hearing care providers are tinnitus experts, even if they claim to be. If you're dealing with bothersome tinnitus, you want to work with a clinic that has providers with advanced training. Look for clinics where at least some of the providers there hold a certificate holder in tinnitus management from the American Board of Audiology. This means that they've gone through specialized tinnitus training. It's not just a weekend course, it's advanced knowledge and clinical skills specific to tinnitus management. You also want to look for a clinic that has tools and comprehensive approaches to actually help you. For instance, do they offer advanced treatments like linear bimodal neuromodulation? Do they provide cognitive behavioral therapy training? Do they help with lifestyle modifications that can impact the tinnitus that you have? And here's the big one. Do they have ways to objectively track whether treatment is working? Not just handing you a questionnaire or asking, how's it going, but actually measure things like heart rate variability to see how your nervous system is responding to treatment. Do they use real ear measurement equipment when they're fitting their hearing aids? These things tell you whether a clinic is set up to provide real comprehensive evidence-based tinnitus care or if they're just trying to sell you hearing aids and hope for the best. Now you need to be realistic about the timeline. Some people get immediate relief. For others, it can take weeks or months as the brain adapts. And for people with significant tinnitus distress, hearing aids often work best as part of a larger comprehensive treatment plan that could include cognitive behavioral therapy, sound therapy, and lifestyle modifications. We actually have detailed information about comprehensive treatment options in our online learning center. I'll put that link in the description below if you want to dive deeper. So here's the bottom line. The research shows about 75% of people get meaningful benefit from their hearing aids for their tinnitus, and that relief often improves over time as the brain starts to receive adequate sound input again. Those numbers go up to nearly 90% when hearing aids are used as part of a treatment plan with cognitive behavioral therapy and linear. Hearing aids are not a cure, but they're one of the most effective tools we have when they are used correctly, and that's the key. When they're used correctly by providers with the right training and the right tools, with proper evaluation, fitting, and realistic expectations. Now, I want to hear from you. Are you dealing with tinnitus and hearing loss? Have you used hearing aids to help with your tinnitus? Did they help or not? Are you considering trying them? Drop your comments below. Your experience helps other viewers who are trying to figure out the next steps in their tinnitus journey. And if you want to learn more about tinnitus and management strategies beyond just hearing aids, you can go to that learning center I mentioned below. If you're here in northern Utah and want help with either your hearing loss, tinnitus, or both, you can schedule an appointment online with one of our clinics. We specialize in tinnitus treatment and have helped thousands of people find relief. Thanks for watching. I'll see you in the next video.